Hi there, this is Dr. Sean Hill here at Lone Star Plastic Surgery in Frisco, Texas. Today's video topic is the recovery process for rhinoplasty surgery. As always, every surgeon has their own particular postoperative plan and instructions, so I'd advise you to follow your own surgeon's instructions. This is more of a guide for our patients as well as for any patient considering rhinoplasty surgery. Rhinoplasty surgery is day surgery, so you come in that day, you have surgery that day, and you go home that day. Typically, it takes anywhere from 2 hours to 4 hours. When you wake up from surgery, you'll have an external splint in place, 2 internal splints, some nasal packing, and typically incisions on the fleshy part of the nose right there, as well as some inside the nostrils, and potentially some here on the outside of the nostrils, depending upon your plan. You'll go home that day, you'll have several medications, one of which is something for pain, one is something as a sleep aid, something for nausea, as well as a steroid taper pack, which is to help control the swelling, to help expedite the recovery process. You will typically begin that the following day after surgery. Most patients report minimal pain control. Typically, the main issue after surgery is patients will feel like they're very swollen, and it will help them. It'll be difficult to sleep at night with all the splints, which is why the one medication is very helpful for that. You can shower the next day after surgery. Just no direct water on the splint itself. Try and keep it as clean and dry as possible. No working out for 2 weeks after surgery. Keep your heart rate less than 110. If your heart rate gets up, it does increase the bleeding risk. After 7 days, you will come back to our office. At that point in time, we'll remove the external splint, the internal splints, as well as all stitches. The sutures inside of the nostrils will be absorbable and they will go away on their own. After we take off the stitches and the splints, I will typically advise patients to do nasal taping 24/7 for 1 additional week. After that, first 2 weeks after surgery, you will then do the nasal taping just at nighttime. The taping is important to help kind of control the swelling process, to help expedite recovery from surgery itself. Patients can begin working out after 2 weeks from surgery, getting your heart rate. You can do essentially any activity you like after 2 weeks, and that's the recovery from that. We do prescribe or give scar gel as part of our recovery packet, which is Silogen, just silicone impregnated scar gel. You'll begin that 3 weeks after surgery. Rhinoplasty recovery, in my opinion, is more of a marathon than a sprint, because the challenge for rhinoplasty surgery is that after surgery, you'll remain very swollen for up to 12 to 18 months after surgery. I typically tell patients the first 3 weeks, 70% of the swelling will be gone, but that last 30% may take up to 12 months as stated, and it does require a bit of patience as you wait for the final results to come in to form. That is my recovery process for rhinoplasty surgery. Again, follow your own particular surgeon's advice. My patients, during the initial recovery process, if you have any questions or concerns, you can always email me or call me directly at any point in time, and I'd be happy to answer your phone calls. If there is a medical emergency, obviously that's call 911 or go to the emergency department. Thank you so much again. Sean Hill here in Lone Star Plastic Surgery in Frisco, Texas. Thanks for tuning in.